Hello everyone, I'm Dr. Sarah Rashid, one of the teaching assistants at Department of Anatomy, Faculty of Medicine, University of Khartoum. In our next station, we will talk about the orbit. In the orbit, we will talk about the cavity itself and its boundaries and its contents, which are the muscles, nerves, and vessels, and the opening that nerves and vessels are passes through them. Let us start with the boundaries. The orbital cavity itself, it's a pyramidal structure with the base that faces anteriorly and apex which is posteriorly. On its boundaries, the upper boundary is formed by the frontal bone and the medial one is formed by the frontal bone superiorly and the maxillary bone inferiorly, and the lower one is formed by the maxillary bone on the medial side and zygomatic bone on the lateral side. Now the lateral boundary is formed by the zygomatic bone itself again and the frontal bone superiorly. Regarding the walls of the orbital cavity, the roof of the orbital cavity, as we can see, is formed by the frontal bone. The floor is formed by the maxillary bone and it's called the orbital plate of the maxillary bone and small part of the zygomatic bone. The medial wall from anteriorly to posteriorly is formed by the maxillary bone, which is here, then the lacrimal bone, then the ethmoidal bone here, and the last one is the body of the sphenoid bone. The lateral wall is formed by the zygomatic bone and the frontal bone. Okay, this is the cavity. Now let me talk about the content. Apart from the air ball, there is the muscles inside. There is the muscles inside the orbital cavity which mobile this orbital, this eyeball. Regarding muscles, we have 6 muscles. The first one is the superior rectus muscle, which is originated from the tendinous ring here and inserted at the eyeball just posterior to the coronascleral line. This is the coronascleral line, and this is the area of the attachment of the superior rectus muscle. The superior rectus muscle is innervated by oculomotor nerve, which is the third cranial nerve. When it contracted, it moves the eyeball superiorly. The second one is the lateral rectus muscle, which is originated again from the tendinous ring and inserted at the lateral surface of the eyeball, again just posterior to the corneoscleral line. The lateral rectus muscle is innervated by the abducens nerve, which is the 6th cranial nerve, and when it contracted, it moves the eyeball laterally. The third one, I hope it's clear to you, is the inferior rectus muscle. Is the inferior rectus muscle, which is originated again from the tendinous ring and inserted at the posterior surface of the eyeball. It is innervated by the oculomotor nerve and it moves the eyeball downward. The fourth pair is the medial rectus muscle. Again, it's originated from the tendinous ring and inserted on the lateral surface of the eyeball. The medial rectus muscle is innervated by the oculomotor nerve, and when it contracted, it moves the eyeball medially. The fifth muscle is the superior oblique muscle. The superior oblique muscle now is originated from the posterior aspect of the orbital cavity and through this belly It's inserted at the superior aspect of the eyeball, just beneath the insertion of the superior rectus muscle. The superior oblique muscle is innervated by the oculomotor nerve, and when it contracted, it moves the eyeball downward and laterally. Here. Superior oblique. The superior oblique muscle is innervated by the trochlear nerve, which is the fourth cranial nerve, and when it contracted, it moves the eyeball downward and laterally. The sixth one is the inferior oblique muscle, which is originated from the floor of the orbital cavity here and inserted on the lateral surface of the eyeball, just beneath the insertion of the lateral rectus muscle. It is innervated by oculomotor nerve, and when it contracted, it moves the eyeball both superiorly and laterally. Here we have levator palpebrae superioris muscle, originated from the posterior aspect of the orbital cavity and inserted on the tarsal plate at the upper eyelid. It helps the upper eyelid to open or open the eye. Now we are completed the muscle, and we want to talk about the blood vessels and nerves content of the orbital cavity. The orbital cavity have three openings or fissures through which nerves and vessels passing inside it. The first one, which is located here, are called the inferior orbital fissure. This fissure is formed by the greater wing of the sphenoid bone here and the maxillary bone here. Through this fissure, passing the inferior ophthalmic vein, the maxillary nerve, and part of sympathetic nerves. Here we have the superior orbital fissure, and this fissure is formed by the greater wing of the sphenoid bone here and the lesser wing of the sphenoid bone, which is supposed to be here. Through this fissure are passing the oculomotor nerve, which is the third cranial nerve, trochlear nerve, which is the fourth cranial nerve, abducens, which is the sixth cranial nerve, the nasociliary and frontal nerve. We have also superior ophthalmic vein. The lacrimal nerve is also passes through this fissure or opening. The third opening is the optic canal, and from its name, it is the passage of the optic nerve and the ophthalmic artery with it. Now the optic nerve passes through all this cavity to be entered here in the eyeball. After that, it will give us the retina. Now let's talk a brief talk about the eyeball itself. The eyeball consists of three layers. The outer one is the fibrous layer, which gives the attachment of the muscles. The middle one is the vascular layer, and the inner one inside this structure is the neural layer or nerve layer. Now the middle layer, which is the vascular layer, gives us the choroidal layer. The inner layer gives us the retina, and the outer layer gives us the sclera of the eyeball. By this, we have concluded our talk about the eyeball, about the orbital cavity, and we have talked about its boundaries and structures, the muscles inside it and its action, nerve supply, and the blood supply.